got the COVID-19. We've heard of Boise, where two couples were positive, and then it spread like wildfire within some markets. So I'm hoping that there will be stricter measures to say if we come into your establishment and you don't have, a place for people to wash their hands, if you don't have a no mask policy, if you don't have all these things set in place, we can't close you down for your own safety. I think I would want to see some of these strict measures so that workplaces will begin to do the right thing.
Yeah, the mayor of Tamale yesterday was going around in different places, and initially, I think when he went to, it was Unilever.
Yeah, Unilever.
And there was a little misunderstanding at the beginning, but later on they went and saw what was happening. And I think the whole idea of doing unannounced visits is to make sure that everybody is prepared all the time and doing the right thing all the time. The business of announcing visits, is counterproductive. It's counterintuitive.
Defeats the purpose.
So people prepare for you to come, and then when you are gone, they're like, oh, the person's out of our hair, So I think it's important to do a lot of the unannounced visits, and I think we should multiply that across the country, so that institutions know that they can be checked in on, at any point in time, and they need to constantly be alert, at high alert, not just alert, but at high alert on all the protocols to make sure that their systems are in place and being observed at all times. I think it's important for us to get there.
Yeah. And currently the COVID-19 positive cases in Ghana is at 5,408. Okay, just a couple of months ago we were thinking of 2 people, 6 people, 8 people.
Yeah.
Now we are officially at 5,408 positive people. What that means is we all have to be very, very careful. We can't take it for granted that people are not dying. With the way the virus works, you may think you're lucky, but then it will just surprise you in ways that you don't know. So it's very important for all of us to be very careful. Luckily, our recoveries are still going up. So we have 514 people who have recovered. Unfortunately, 22 people have passed on. And I think for a very long time, we were beginning to just see Accra as the hotspot.
Yeah.
But Kumasi is also picking up.
Yeah.
So it's really important that we pay attention.
We are doing 726 so far in Kumasi. I think if we're not careful, we'll be crossing the 1,000 mark within the next 7 days.
Yeah.
It's very possible, considering what's happening in Obuasi. But just to contextualize the whole conversation, and I really hope the Ghana Health Service can bring us some information as far as that is concerned. But the whole concept of the mild symptomatic situation among the massive or the majority of the positives, right? And the positives is because we're doing mandatory. Not mandatory, enhanced contact tracing.
Yes.
That's how come we are fishing them out, right? Because they're not showing any symptoms. At the moment, the press briefing is on standby. They'll be starting soon. So I looked at the figures on Florida because I was looking at what's happening in the U.S. And I was looking at what's happening in the U.S., the cold regions versus the warm regions, and do a comparison what's happening in Africa, and it looks very similar. So you have what's happening in Florida actually mimicking a lot, of what is happening in Africa. And I found that quite interesting because even though they are not, serious about lockdowns and, they are allowing people to move about, people are at the beaches and all those kind of things in Florida, their case counts are probably among the lowest in the whole of the U.S., And so the suggestion that possibly temperature is playing a role, it's looking like, I want to hear from the Ghana Health Service in this regard, I know everybody was sort of hedging it a little bit and trying to not make any comments in that area, but I think we've had this virus for a few months now. It's been in the world since December. It's been in Ghana at least officially since March. I mean, we don't know if there were any cases before March, but officially since March we've known. So I think it's important for us for them to also come out and tell us what's really going on as far as why are our death rates so low? Is it the protocols in terms of treatment, or is there something else that we are not being told yet? And then also some clarity in terms of what treatment protocols are we using, because we know what people are using at other places, and so on and so forth. So I think that some of these things are what interest me.
Definitely, and so we'll be crossing over now to the Information Ministry, and of course, as you're watching, if you have any questions about all the things that will be discussed, use the hashtag Breakfast Daily and we'll read them out for you, as well as the WhatsApp line 0550585832. If you're outside Ghana, the country code is +233. Let's listen to the Ministry of Information.
To step up the containment efforts there. If technology does not fail, I'll try to connect to them in Kumasi for them to give us a quick update on what they are seeking to do out there. We also have a quick update. Close of business last night around 11 p.m. and the numbers that are available. Dr. Bedusa Akodie would share those. But first, the minister responsible for health has an advisory on community spread. The numbers, as you are seeing, should give you cause for concern, and he has an advisory on community spread, which he will share with us. I want to invite the Honorable Minister Kwakwajima Menu to take the podium and to start us off with the advisory on community spread.
Good morning, ladies and gentlemen. Let me take the opportunity to thank the Minister for Information, Honorable Kwadwo Oppong-Krom, for celebrating with the nurses in our country on the Nurses Day, International Day for the Nurse, last Tuesday. I requested of him to do that on my behalf. He did it very, very, very eloquently and very efficiently, and also add on. Nurses, not because of just the name, but because of the work they're doing for us. I should have joined them on Tuesday, but I couldn't get a message. But I'll still continue to encourage them, motivate them, to try to tell them that Ghanaians are satisfied and happy with the work they do to protect us from diseases and take care of us when we are ill. So we thank all nurses in the country, in addition to other health professionals. When their days come, we'll also celebrate them as well. The last time I came here, I made some very good factual statement that coronavirus has come to live with us. It will have nowhere to go, and we'll have to live with it. There are several diseases that we live with. Malaria has been with us for how long now? HIV/AIDS came. We have never been able to take it off. We still live with it. H1N1 is still around. We live with it. There are several other diseases that we live with. Non-communicable diseases. They don't get spread and they are not infectious. But when you get it, you live with it. And the word that we all use is managing to live with the disease. So if you are diabetic, they will ask you to take medications depending on your body chemistry, some milligrams once a day or twice a day. In some instances, you have to inject insulin into your body. That is how you live with diabetes. Hypertension, we live with it. So now, the fact is, coronavirus has been with us, so they call for a novel, new. In the past 3 or 4 months, the world is living with it. The impact is severe, very, very severe elsewhere, because people are dying in numbers. Here in our country, we are now seeing community spread, but we are not dying. Dr. Bedusa Akodie will come and give you numbers again. Or death disease. So what we have to do now is to live with it and manage ourselves against it. So what should we do? So far, there is no medication we can take. There is no vaccine that we can actually get to vaccinate ourselves against the virus. But there are certain things that we know we can do to protect ourselves. One of them is what I'm wearing. So we are managing to reduce the spread. Because for all of us, when we see numbers of infections going up, we begin to get scared. So why would we want the numbers to go up? We will have to find a way to ensure that the numbers don't go up, but they begin to come down and come down and come down. So if we are adhering strictly to the guidelines, the education, the type of things we are seeing here on the screen, strictly by them, we will be seeing these hypes that is going on in some parts of the country. One, we have managed to establish that when we continue to do our things in groups, those in the factories, those in work at Eastern region. So what do? They are asking us to observe social distancing. Yet, some of us behave as if we haven't heard what is going on. So we should begin to accept the fact that the disease will be here for a while, but we should try to reduce the rate at which we are spreading and getting infected. We start the fight very early. So this education has been going on and on and on and on. What do? We cannot stop economic activity in our country, our social life, our children's education. So we need to do something that will enable us to live our normal lives. For how long can we continue to be in a situation where schools have closed down? Our children who are going to write exams now do not know their fate. Because what we are seeing, the spread, may not encourage the president to release restrictions. And I'm pleading that the type of education that we are getting should be taken in consideration and protect yourself and ourselves. Because if you get it, it is very likely that the next person close to you will have it. So let us wear the masks, let us wash hands, let us sanitize where necessary, let us keep away from each other, social distancing. And these are very critical things that will help us bring down the rate at which we are spreading the disease. In some of the regions, we haven't seen any. What is the magic? Some authorities in the regions and the districts are closing down overcrowded markets. And even in Accra, we see situations where some of the markets were closed down. They've redesignated some places that are larger so that they can observe social distancing. That is a way of learning to live our normal lives to avoid the spread. So the key phrase now is that let us learn to live our normal lives, but sure that we are reducing the spread. And what things shall we do? And those of you in the media landscape, when you see a personality and you're interviewing, because you want stories, to go first, you forget about social distancing. And then you see on the cameras, everybody bringing their microphones. Is that the way we should go to live our lives? But now they are telling us that the cure is wear a mask, wash hands, distance social distancing, let us observe them. And I wonder how many of us ask another person who is not in a mask to put on a mask. We are meeting employers and finish guidelines by close of work today. The banks I know now are not allowing people without masks into the banking hall. And I told one bank manager yesterday that why don't you find somebody to come and stand there to sell masks so that somebody who doesn't have can easily get one to buy to access banking. The town stations, the drivers are committing themselves, and the associations said that buses that will go on, if you don't wear a mask, you won't get a seat. You should wash hands before you even go on the bus. Gradually, these things are becoming part of our normal lives. And we should all accept to obey or adhere to these guidelines. They are not very comfortable anyway. But we are not in normal times. You manage what is around you. And I think we should learn to do that. Factory places, where do they eat? We're now beginning to think and suspect. Maybe in their canteens, they get closer to each other. They queue to take the food. When they are eating, they take off the masks. So it is likely that when one person gets it, another will also get it. Through that, which door do they use to enter the canteen? So many of us are talking unnecessarily. And if you are infected, you open your mouth and the virus comes out. So again, if you don't need to, don't talk. Especially when you don't have the mask. They are telling us that we shouldn't even laugh. Especially when you don't have the mask. You shouldn't even sing. You see where we are moving towards. If you don't observe these basic guidelines, the disease will continue to spread. Unfortunately for us, in one aspect, and I'll use the word reservedly, unfortunately, quite a large number of those who have been tested positive don't show any symptoms of illness. The scientists use a word they call symptomatic, meaning that you are positive, but you are not showing signs of illness. And that makes our situation very dangerous. If somebody is showing signs of illness, he or she himself or herself will go to the clinic, and when they test positive, they will begin to treat a sick person. But those who are not ill, if the enhanced contact tracing people don't pick you as a contact of another person so that they are coming to try to test you, nobody comes to you, and you are in the community, and therefore the relativity of spread begins to become bigger. And that is why we say, if you're observing the rules, whether asymptomatic or symptomatic, we are cutting you off the red chain, and we can then protect ourselves and you yourself as well. So let us continue to observe these regulations. At the workplace, we shouldn't be so us. By tomorrow, we might have come out with guidelines to guide employers and employees so that workplace practices will begin to also help cut the spread and bring the positivity down. If you're able to do that, we have won the battle. We are not dying in droves. We are not getting so ill in droves. Our hospitals are now even vacant. Before coronavirus, we were talking about no bed room. You remember? Now with corona, other countries have that problem. We have placed in our hospitals the beds that are empty. And that is a good indication. Our system is not very strengthened. If we should begin to get ill, our hospitals will be full. And then we may move into situations where people are showing symptoms, they are dying, and wouldn't have places to take them. And that is not what all of us wants. So if we don't, at this stage, find a way of cutting the spread, and we allow ourselves to be moving toward that era, our situation will be catastrophic. So all of us should become ambassadors to preach wherever we are that we should observe the basic rules or guidelines that have come out. They are not very difficult to do. So I don't understand why some of us do not do these things. And we have been thinking about what next do we do to enforce strict compliance with these basic guidelines. We are working on that. I believe soon you will see the police arresting some of us who are becoming too recalcitrant. And if you are jailed for 3 months for not wearing a mask in public, probably we'll take a cue from that. So I came to talk to you about the significance of adhering to the guidelines. I believe that that is the only sure way we can begin to bring the positive situation that we have in our country. The gatherings should not be encouraged at all. And if you don't have anything very serious to do, you can see at home, these days, television, laptops, games, and whatever it is. There's a lot to occupy you in the house with. And this is not a time at all to be visiting people. Let us wait and hesitate a little while to see where coronavirus will take the country. Our economy, if you are not careful, will collapse completely after we have finished fighting the invisible opponent. So whilst we try to observe to take ourselves away from illness, let us also begin to think about the situation we are putting our economy in. So many of us are in rooms now, they are not coming out, with no money. So we want a situation where everybody can come out, at least work a little while, grow the economy, let them also get some little bit of money to eat with. But if you continue to be recalcitrant without adhering to the rules, guidelines, these things cannot happen. We are still investigating into situations like Obuasi, Tema, the factory floors, and other places. We believe we can find an antidote to the spread in these locations, and we are also learning from those that are not getting it entirely at all, to see what we pick from there to come to do in Accra and elsewhere. But the bottom line is that stay at home, let us adhere to the rules and guidelines, and let us work with the objective of trying to cut the spread in to reduce the positive numbers that we are going to. Let me thank you, Kojo, for this opportunity. Thank you.
Honorable Minister, thank you for that advisory on community spread and what we all need to do about it. Shortly, the Minister responsible for tourism and creative arts will join me with some further clarifications on the hospitality sector openings. But before then, let me just share with you an update on our engagement with stakeholders on a post-restrictions era. As we've been hinting, government has commenced a series of engagements with stakeholders to examine potential post-restrictions measures that will ensure safety of citizens while allowing for some level of normalcy in daily activities. You would recall that from the 15th of March, the government of Ghana has imposed and subsequently amended various restrictions aimed at protecting the population and at the same time allowing economic activity to proceed. Government envisages that in the coming weeks, it will need to outline a gradual plan for post-restrictions era. Pursuant to this, the President of the Republic, Nana Addo Dankwa Akufo-Addo, has commenced engagements with various stakeholders on safety measures that can allow an easing of the restrictions without compromising the health of the population. He has already engaged with the Association of Ghana Industries on potential measures for workplace safety. You heard the Honorable Minister speak to that. Industry has volunteered some measures which will be made mandatory in all workplaces, and these measures are currently under consideration. The President has also commenced engagement with the education community on potential post-restriction measures that will allow a reopening of schools while protecting students, faculty, and non-teaching staff. The President is very concerned about the status of the millions of Ghanaian children whose education is now challenged because of the restrictions, and is examining what it would take to ensure that learning and examination is not ultimately compromised. He's also been engaging with the transport sector on how to ensure more compliance and safety on public transport. There are also legal options that are now being considered to ensure stricter enforcement of personal preventive etiquette, including the wearing of masks, as the Minister has just alluded to. Hopefully, those legal options should be announced soon. The sports community, in particular football and golfing, have also submitted proposals on potential easing approach which could still protect the population. Faith-based organizations have also submitted some proposals on how religious activities could be reallowed while protecting the population. Now, I crave your indulgence to please pay particular attention to that. The government is grateful to all these groups and those who will be engaged in the coming days for their cooperation so far. But note that the fact that you are being engaged does not mean the proposals that have come from you have been accepted or the restrictions have been amended or lifted currently. The restrictions remain in full force and offenders will be arrested and prosecuted. The engagement is only for a post-restriction scenario and should be clearly understood as such. And just in connection with that, I want to invite the Honourable Minister for Tourism and Creative Arts to give us some further clarifications on the hospitality sector openings following yesterday's back and forth. Honourable Minister.
Thank you very much, Honourable Minister of Information, Honourable Minister of Health, senior government officials, as well as the media. The Ministry would like to take this opportunity to clarify directives that were issued by the Ghana Tourism Authority pursuant to the President's address on Sunday. The Ghana Tourism Authority, per directives issued to the hospitality industry, inadvertently eased up the restrictions applicable to the industry by indicating that food chains and restaurants could operate sit-down services by observing social distancing protocols. It was also indicated that drinking bars could operate and also comply with social distancing protocols, but nightclubs would remain closed. However, we wish to clarify that further to the directive of His Excellency the President regarding the extension of the ban on public gatherings, the status quo remains the same, which means that bars, drinking bars and nightclubs remain closed. They cannot operate. Food chains and restaurants, including restaurants in hotels, can operate takeout and delivery services. This means that you can go to the food chain like Papaya or KFC, order your food and carry it away and have a meal in your home. Or you could go to a restaurant, order a meal and carry it away. On the other hand, you could also take advantage where they have delivery services to place a phone call, order your meal, and it will be delivered to you at home and you can enjoy your meal. So this is a clarification that we want to bring to the public and to industry, and we hope that they'll ensure compliance with these clarifications. We also recognize that this issue may have arisen because of an inadvertent indication of drinking bars being exempt in the EI 64. When you look at Clause 1 of the EI, which lists activities that are banned, it includes nightclubs and drinking bars. But when you get to the clause where they indicate the exemptions, all the activities that are listed under exemptions are not captured under clause 1 imposition of restrictions. So we have given it a passive interpretation to indicate that the inclusion of drinking bars in clause 4 under exemptions was inadvertent on the part of the draftsman, and therefore, right from the beginning of application of the ban on public gatherings, drinking bars as well as nightclubs were banned from operating. The status quo remains. Drinking bars, nightclubs are not open. Food chains, restaurants can operate per the guidelines that we're given in respect of takeout and delivery services. Hotels are exempt, but we also issued guidelines to the hotels in respect of taking care of their guests within their premises. We know that the way hotels are set up, guests have their rooms, they have their washrooms in there, and they can undertake all their activities within their rooms. The hotel restaurants cannot provide buffet dinner, buffet lunch, where we can go and congregate to have a meal. But they can take care of their guests whilst they are with them by providing them with food. And I think that is spread, and very soon we shall overcome this COVID-19 disease and return to normalcy where we can enjoy all our social activities. Thank you very much for the opportunity, Mr. Minister.
So, Honourable Minister, thank you for that clarification which you provide. And again, we make that point to all our stakeholders and stakeholder groups. We are going through a process of engagement. The fact that you are being engaged does not mean that the suggestions have been accepted or that the rules have been amended. And we will comply with them so that we don't have to get law enforcement to come in. I want to invite Dr. Bedu Sarkodie, Head of Public Health at the Ghana Health Service, to give us an update on numbers as at this morning before we proceed to do the Q&A session. Doc.
Thanks very much, Honorable Minister. Your Honor, Minister of Health, Minister of Information, Tourism and Creative Art, Minister, distinguished ladies and gentlemen, I provide the updates on the COVID situation in Ghana as at close of yesterday. From the last briefing, the new cases confirmed that added to what we reported 122, with the distributions in Greater Accra 57, Ashanti Region 62, Central Region 2, and Western North 1. 2 more new deaths were added up, bringing the death toll to 24, with 24 deaths among 5,530 cases. The death to positivity rate, which we term as the case fatality rate, stands at 0.43% for the country. The total number of recoveries have increased, and indeed we have done quite a significant number of people having done the first test, which is negative, and you are waiting for the second test to declare them recovered, fully recovered. And the total number of recoveries as of now stands at 674. I'll just give a bit of details with regards to the new cases that we confirmed. In Greater Accra, 57 cases reported came from Tabamet 51, Ashama 2, Poliklote 1, and 1 each from Accra Metro, Ladadi Kotopon, and yes, I think these are the districts from Accra. Central Region reported 2 new cases, 1 each from Ewutisenya, East Kaswa, and then Winneba, 1 each. Ashanti Region reported 62 new cases, 12 from Kumasi Metro, Obuasi Municipality 22, Askorima one, Afijasa South 2, Achuma Kwangoma 19, 5, 1, Tao 1, and then Salvation Army Hospital also reported. We had one new case from Bibiani, which is from Western North. This brings to the total new confirmed cases to 122. With regards to the regional distribution, Greater Accra has 4,204. Ashanti region, 788. Eastern region, 99. Central, 192. Western, 61. Western North, 57. Volta, 34. Oti region, 24. Northern region 19, Northeast 2, Upper East 26, Upper West 21, Bono East 1. So out of the 16 regions, 13 of them have reported cases, and those regions that have not reported cases yet are Bono, Savannah, and Ahafo. I think, Your Honor, the Minister of Information, this is the situational update for the country. Thank you much.
Thank you, Dr. Bedusa Kode. As I mentioned earlier, the Director General himself and some members of the Ghana Health Service team for the surveillance, the disease surveillance department, etc., are now in Kumasi en route to Obuasi to wrap up efforts at containment in Obuasi, including contact tracing, etc. We had hoped that they could join us this morning by technology, but I'm informed that they are currently in transit, and that makes it difficult for them to join us. We will do well to get you an answer from them by Tuesday when we re-engage on who we are. We're going to take questions and provide answers now. Before we do that, I understand that the Ministry of Information is receiving some 10,000 PPE kits so that we can also assist the media and other frontline groups some more. I'm informed that this donation is from FIO International. Do I have a rep from FIO International here? While we do that, may I ask that the microphone be set up so that we can take the questions, if we have any questions this morning. Yeah, can you put, no sir, please wait for me. Can you please put the box down here? Honorable Minister for Tourism, would you do us the honors to receive on our behalf? Though we can't shake hands symbolically, if you can receive this on our behalf. This is just one of the, this is about 10,000 PPE kits to the Ministry of Information from FIO International, and we'll be making it available to add to what we are making available to journalists and other frontline groups. The team is led by Mr. J. Bafo, our Operations Director at FIO International. So thank you very much, FIO International, for supporting particularly our media colleagues through the Ministry of Information with your donation. Thank you so much. Thank you. Thank you so much. FIO International. Thank you. Do we have any questions? So if we don't have any questions, we can call it a wrap this morning. So we'll take two at a go and then we'll invite some more. Yes, sir.
Good morning. My name is Bill Bennett with FM and Top TV. Honorable Minister, I believe this question might be one that you might want to look at, and also to Dr. Bezakodia. We recorded 24 deaths as at today, this morning. I believe it's on the minds of many Ghanaians to know whether out of these 24, we have some of them mainly from the critically ill patients that we have, or these are just random new deaths or new cases that we are reporting. This is out of the 24. And out of the same 24 deaths that we have, do you have any from those that were quarantined after the deadline? Also, Are the victims of these deaths being tested upon arrival at the health facilities after their diagnosis or prognosis? Do they show any critical symptom that preempts the medical practitioners to want to test them for COVID?
The final one, quickly.
Yes, the final one. Are any of these facilities or these hospitals, are they conducting any random tests just to make sure that as part of the contact tracing, we are not missing any critically ill patients who have died out of COVID? Is something like that going on?
Are hospitals conducting random tests?
Yes, random tests.
Okay, thank you.
Thank you.
Thank you very much. My name is Joseph Akablai with Joy News. The first question, I want to find out from the health minister if you could throw some more light on the employment guidelines that he says they are putting together, specifically whether government has any intention that it will be issued maybe as an EI to ensure that it will be enforceable for those who may not abide by them. The other one has to do with the Obuasi situation. You had mentioned we'll be joining them. Since you're unable to join, I just want to have a brief on what exactly the team is going to do there.
Okay.
And also for the tourism minister, if she could kindly explain how the communication, which has now been indicated has not been accurate, was issued in the first place, because she made reference to the EI. Do I get to suggest that it was as a result of that drafting issue that led to the tourism authority issuing that statement in the first place?
Okay.
And also, President Akufo-Addo during his address to the nation stated that some of the cases that accounted for the rise were from a backlog dating from April 26. I recall Sampofo of Noguchi had stated that there were no backlogs except KCCR, which had 1,982 samples to be cleared by Thursday, May 7. I just needed a clarification whether the backlog the president was referring to was that of KCCR, especially because about 500 of those cases he made reference to had to do with those at Tema, the Tema factory.
I get your question totally, yes. And we'll have to just help you with them.
Just a final one about the Tema case. I just want to find out whether the 50, he said about 52 cases also from Tema area. I just find out whether it's connected to the factory.
Okay.
Thank you.
So Dr. Bedisako, the new 52 cases from Tema, do they have any connection with the fact that recorded there about 500 or so? And then I'll come to you first question as well. The critically ill, are they the ones who are falling into the death bracket, or those who are being reported as having died a different set that maybe just show up at the hospital and before you realize they pass on? And when you do a post-facto testing of samples, then you realize they are COVID positive. So I'll come to you with those ones. Honorable Minister, employment guidelines, do you want to do it by EI? I'll come to you on that one. The team in Obuasi, what exactly are you going to do? I've given them an update on it. I don't know if there's anything extra. And then Honorable Minister, the one on Ghana tourism. So let me take this last one and then we'll provide answers here.
My name is Kojadran from City News. The minister made mention that they are engaging in the to come up with guidelines at the various workplaces. In the light of that, let me ask a question regarding the Tema case where one person infected over 500 people. What has been the engagement with this company, and how was that donation made between what period did we found out that these people have been infected? And then my second question is, we're getting reports that staff of Noguchi were involved in the testing of various samples have not been paid. What is the payment model there? And regarding the online education for various public schools, we know that most students at the public schools fall below the poverty line, do not have access to internet and other gadgets to learn. How are they being taken care of in terms of reaching out to them so that they also benefit from the online classes?
So let me take that one, and then about one or two more, then I'll invite the other colleagues. So I think yesterday, for example, the president issued instructions on an assessment of how the online education is going, and whether there are some who are falling out of the cracks, or whether everybody is having an opportunity to be onboarded. It is as a result of the engagements that are ongoing to ensure that education and examination is not ultimately distorted. And so the President has instructed for an assessment of how the online education or the distance education using television and other means that have been rolled out by the Ministry of Education is faring so far, so that we can inform further decision-making on that front. Honorable Minister for Health, please take note of the Noguchi question. I just want to contextualize something, this backlog issue. You will recall that right from the beginning, there are some procedures we have laid down on reporting and announcements. For example, we have said that we're not in the business of naming in-laws. We've been under a lot of pressure to name people. And we've said that as a matter of policy, we're not in the business of doing that. We've also said that as a matter of policy, the persons who have tested positive have to be informed and potentially moved by the time the whole public is being informed. I'm sure you recall, because we did not want to have some of those early incidents where somebody hears about his positivity on radio or from the podium. You recall that one. So there's a difference between clearing backlog in the lab and finishing the process of gauging all of these people, moving them into isolation or treatment, so that, for example, when Dr. Abuaji is here, he can say 400 people have tested positive and they have been moved into isolation. That presupposes that between the time that sample was taken, they have done this engagement of informing either the clinician or the surveillance team that went to find the positivity, work towards moving person, and then it is announced. So your question, I'm providing this information so that you can begin to contextualize your question even before, if other colleagues would speak to it. Honorable Minister for Tourism, please join me. Yours is a single bullet, so take your bullet and then let's. So, are you saying that it is the draft that led to the initial interpretation? Please come this way, by the Tourism Authority, which interpretation you have now sought to correct? Or there's some explanation?
Also to indicate that the Ghana Tourism Authority is the regulator of the hospitality industry. And therefore, periodically, they issue directives to the industry during this period, this pandemic period, as to how they could operate safely, pursuant to the decisions of government. But I think that the last directive introduced some easing of the restrictions, which were not in conformity with the President's directive that the ban had been extended to the end of the month. So that is the clarification that we sought to do. And I believe that if we all comply with the restrictions as existed prior to this directive to the end of the month, the government may come out with further directives, and we will advise the industry accordingly.
Honorable Minister, thank you. Honorable Minister responsible for health, if you can help me with Gucci payment issues. I think Kujajman says that the information that staff of Noguchi have not been paid, who involved in the testing have not been paid. I think maybe we should nuance it a little bit. Have not been paid yet the extra allowances for frontline workers. Not that their salaries, etc., have not been paid. I'm just nuancing it so that we get it. So, Minister, you may want to take that for us. And then the employment guidelines, do you want to do it by EI or there's some other route? And I think the rest will go to Ghana Health, unless you want to comment on something. Please join us, Minister.
Thank you, Kojo. This is an unfortunate situation. It looks like some wrong information had got into Noguchi, and I'm sending my chief director to Noguchi this morning to join the head of the institute, Professor Abraham, to explain. So far, this extra allowance the president announced to be paid to frontline workers has not been paid to anybody yet. All the heads of the service providers, the Health Association, Ghana Health Service, the quasi-government institutions, the teaching hospitals, or the CEOs have signed an arrangement and said to the minister that we should hesitate a little bit for them to continue to dialogue with their own staff, the nurses and the doctors, and until they come out with an agreed sort of arrangement with the workers, we should not begin to work on the 50% advance that is supposed to go to anybody. Noguchi cannot be left behind. We are adding the clinical academic consultants, the university lecturers who practice medicine in the teaching hospitals. They are all part of it, including some veterinary people who are even doing testing, but being paid to anybody. And then last night it came out that Noguchi people are complaining that we have paid the allowances to people and we have left them behind. This cannot be true. You haven't done anything. And I want to assure Noguchi staff that we will never leave behind. This is a battle that we are fighting together, where the eye is even more serious than the doctors and nurses sitting even in treatment centers. The exposure levels are high, so we can't leave them behind. Any time we do these allowances, they will get their fair share of allowances. Whatever thing that they are looking for, my chief target will explain why certain things might not have been done and how we are going to try to rectify the anomaly. So that is the situation. Throwing light on the workplace protocols, guidelines. You know, when we started, we came out with guidelines as to how we can break the chain. Then all of a sudden, we're seeing pockets of these infections in the factory floor, the mines groupings, the railway workers. So we just want to find out what guidelines have they instituted and how are they practicing the guidelines in factories. Initially when we started, I think it was even here or somewhere in the meeting, Nestle announced work practices. What they said was that they have divided their staff into two, so that one group goes on leave for 1 week, another group goes away for 1 week, so that they can create space for social distancing in the offices. Civil Service wrote a memo, Public Services Commission, that within that place, our enclave, those who are not doing critical tasks should be out to stay home. So we sent all our interns, the national service people, everybody, home. And then even directors in there, some of them who are not doing critical things, were sent to them and we're calling them when it was necessary, and some were working from home, such that we can create space for social distancing. This is why we are now engaging in that. We were thinking that they were practicing these things. Then if we are seeing positives all of a sudden, and the spreading and large numbers, we are meeting with them to see what they have done so far and what we want them to do. If after our engagement, they are bringing proposals at this point, we realize that there's a need for us to do an EI to support what it is so that we can enforce it with a legal back, then we will so do. That is all I can say are these guidelines for now.
Yes, thank you. I want to invite Dr. Bedusa Akodie. Your 24 deaths, are they the critically ill persons, or this is some other category of persons? For example, your travelers who were mandatorily quarantined. There's also another question about whether hospitals are randomly testing. There's a request from Joseph if we can provide some more information on what the team in Obuasi is headed out there to do beyond what we've told you already. Say again? Yeah, and then there's a question about whether the 52 new cases from Tema are connected to the factory where the 500 was recorded. So, Doc, please join us.
Thank you very much once again. The figure that we see for the critically ill, they often remain same for some period, and then it will go up slightly or reduce. I wish to indicate that this is a dynamic figure. Most of these people do recover, their situation improves, the signs and symptoms become less severe, do recover from these signs and symptoms. So the figure, if you see 5 for a period, don't let us think that the same batch of people that remain critically ill for that period. And indeed, almost all that have died didn't come to be observed in our hands as critically ill and put on ventilators before they succumb to the disease. So most often they come to the hospital even being managed for a condition that initially was not considered COVID, and then later either the clinician may observe some new syndrome, which will prompt that individual to think about COVID, and then they take the sample, and the report may come after this person has died. And then almost invariably within an hour and 24 hours to less than 48 hours, most of the people that died, that is how the death would happen. So that's a dynamic, those that are critically ill, that move on to death, and that is the situation.
Just a quick follow-up. So your 5 who are critically ill, are there any who are on ventilators?
For now, no.
None of them is on ventilators.
And then whether the hospitals are conducting random testing, this has not been the national guide. We have not given out a guide for hospitals to randomly test people that come or use their facilities. If anybody is doing that, we are not aware. But as much as possible, what we do at the facilities, those that are being observed, when you observe it for 14 days, on the 14th day, we take a second test, post-positive, and 2 tests in succession. On day 14, day 16, if the 2 serially are negative, then you declare you recovered. If for any reason one of them is positive, then serially you continue doing tests until we get convinced that 2 successive tests have been negative. So that is the situation on the random testing. With respect to the engagement of the industries and the situation in Tema, as soon as the first case was a work there confirmed, we followed up during the enhanced contact tracing, and quite a significant number came up to be also infected. Then using the snowballing approach, as soon as we find a body positive, all the various people whose activity have brought such people in contact with any new confirmed cases, we follow up appropriately and then do the respective and appropriate contact tracing as per our guide for the country. So all these people that we observed positive or have been confirmed positive, more than 500 that was rarely mentioned in the industry, we are following their contacts either within the factory, to the home, place of other areas that their activities do take them to, and do the further contact tracing. The 52 new cases we are now, just came last night, a few hours ago. We are now conducting detailed investigation out of this. Few of them may be linked to some of these cases confirmed from the factory. But as of now, you don't have that detail, how many of them, if they are part of the factory employers or employees, and then how are they linked to the confirmed cases that we detected within the industry. I think that is what I was saying for now.
Was there any further information on
it's work in progress. You don't have much information now. It will be difficult to provide any information on that for now. Thank you very much.
That's why I'm trying not to touch the bill myself. So when you touch it, then you have to. Yeah. Okay, so we have another set of, I think, 3 questions. You have a question? So at these 2, then you can come. Social distancing. Yes, madam.
Okay, so my name is Paku from Media General. All my questions actually goes to the Ministry of Health. And the first one had to do with, the minister said quite a number of the cases that test positive are without symptoms, which the scientists say asymptomatic. I want to find out the percentage of persons who are at their age bracket, because we understand a 9-year-old child has recently died of the virus. I want to get that breakdown and how they are being treated, because
so what percentage of our cases are asymptomatic at the time we find them?
Exactly.
Okay, I think we can extrapolate that from the enhanced surveillance as a percentage of the total. Yeah.
Okay, and secondly, The Ghana Registered Nurses and Midwives Association on the assisted anniversary revealed that quite a number of their healthcare workers have contracted the virus, while some are still in mandatory quarantine. I want to find out their insurance packages. Have these nurses access it? What is the process like? How soon will those who have already been infected access our insurance packages? And finally, the PPEs are distributing to the healthcare facilities. I want to know the sustainability plan. Is there a plan that in the next 2 months or a month, we are estimating that it will get finished and then we'll supply with more? Because we have some health facilities, as at yesterday, that they have to manage the way they wear their PPEs because they don't know when they would receive the next batch. Thank you.
Thank you very much, Sarah. Yes, sir.
Good morning. My name is Richmond Hagan.
Your name is?
Richmond Hagan.
Hagan.
Yeah, from the Event Vendors Association. Please, I would like to ask that...
From the what?
Event Vendors Association, part of the hospitality industry.
Okay.
Please, I would like to ask that a person who has been infected with the virus, if God willing, that person has been safe, it's advisable for that person to donate blood to the family member or relative.
Welcome back. So that was the presser from the Information Ministry. So far, we've heard from the Health Minister. We've also heard from the Tourism, Arts and Culture Minister, as well as the Information Minister. The number has increased, okay? So currently, we have 5,530 people positive from COVID-19. The good news is 674 of them have recovered. So that's really great news there.
Yeah. The proportion of recoveries vis-a-vis the cases is actually now going up.
Yeah.
You know, so I haven't worked out the percentage yet, but it's actually going up now. So we're looking at an improved situation. The Ministry of Information is back with us.
I'm going to say positive. The person who said, I can figure out Dr. Demayana say an great case. And also, tema factory issue. On a more no, now more practice protocols in our government. There say social distance, and as Mufi said, then a combine 80 infected over 500 people over there. And then another question. Yenya Edruana, I mean, as the Madagascar, Yenya report on a place say, Omamuye helps, you know, Oma presented some report to the Honorable Health Minister. Honorable, are we getting some medicine? Are able to meet the cure? Send Madagascar for Omo. And also, Honorable, last question here. Nipa bebree ha, person with voluntary testing. Is there any plans in place? Obi person with voluntary testing, obetimi akọ because obi ha onyebi but ebi onimi so onyebi no dey spread. Is there any plans in place? Obi person with voluntary testing ebi yabana.
That's it. That's it. Mr. Obeje, let's just wrap up with questions at Press Pool platform.
There's a question that says that why should a government not consider punishing those who disregard directives with community service instead of jail term, especially when the president granted amnesty to some prisoners during the COVID period. Now, there's also a question asking, will Obasi be put under lockdown? The reason being that with 262 official cases now detected, the unofficial number is likely to be higher. These people who've been tested positive will travel to our towns and villages and will infect others. So wouldn't an early lockdown help to manage the situation? And the final one is a request to the Minister of Information. When are we getting representatives from the Security and Exchange Commission to come and give updates on the fund managers? Thank you.
Okay, so we'll take the manager's request under advisement. Honorable Minister of Health will deal with the Obuasi lockdown. I will deal with the question on why not punish offenders with community service instead of custodial service. Well, that's how Parliament made the law. In the end, that's how Parliament made the law. But Cabinet is considering a community sentencing policy. Because, you know, in Ghana, we don't have a community sentencing policy properly so-called. So Cabinet is currently considering one, which, if successful, then when Parliament is making laws, all of these become options that will be embarked upon. I hope I've provided some clarity to the question. Obuasi, is there consideration of a lockdown in Obuasi? And then a few other questions. Honorable Minister.
Thank you, Kojo. The Director General for Ghana Health Service should be in Obuasi with a group of epidemiologists and surveillance people now. Not until he comes back. This question will be difficult to answer. But generally, the lockdown is not something that we believe is going to work any longer. I've said that now we have realized the lockdown taught us a lot of things, and its impact is quite severe. So what we have to do now is to learn to live with the disease. So they go and come back and we'll get their report. It will determine, it will drive us to make certain decisions, and not until they come back. We must be very careful as to whether we are talking about lockdown in Obuasi or not. The nurses insurance thing. We have done for 10,000 staff. There are three elements of it. If you fall ill, you'll be treated. But if you should get in a situation where you become temporarily disabled, then you will get 10,000 Ghana cedi. But if they treat you and you are well and you can go about your duties without disability, that doesn't qualify you to take that money. If one gets infected and one dies, we'll give 350,000 for life. If you get ill and we're treating you and the cost of treatment goes beyond certain margins, we'll pay 225,000 extra to take care of you. These are the three components. And if you get into a situation where you have been exposed and you want to apply for it, you should consider that these funds should be vetted before you become eligible even to take anything that is there. And I think we have said this to the nurses and the doctors and all the health workers, even those testing and everybody. So that is what is in the public domain now. The PPE sustainability plan. We did program for PPEs for 6 weeks. But even into 2-3 weeks, almost all hospitals are sewing their own PPEs now. Corporates are sewing their own PPEs now. Companies are providing PPEs for people. So far as the disease continues to live with us, we'll make sure that our health workers are protected all the time. So there is a massive sustainability plan for PPEs to the hospitals. But let me say again, whichever hospital, whichever health center, whichever maternity home, whatever it is like, that is still complaining about PPEs, please let us know. The other time we gave a number, 311, is that correct? And class, we will find you where you are and address your complaint, because we have now at least the minimal PP, which is this one. We have them. We are sewing ourselves. Even the N95 that is used in the treatment centers, we have them. So whoever has problem in any place that we want PPEs, let us know. We'll investigate why you still don't have it very quickly and see how best we place PPEs at your doorsteps. I'll leave the guidelines for schools and whatever it is to the public health person in Ghana Health Service to come and do that one. And the guidelines for persons with disability, I think Kojo has reserved that one, Minister, for this. And I think I'll leave the rest for Badu Sarkodie to do. The Adroman, Abednego, I've talked about the lockdown issue. Sarkodie, you do the voluntary testing and the Sherman factory, whether they were practicing protocols or not. That is why we are meeting the factory people. We want to find out what they were doing. I've met once, they're giving us, these things yet. But we entered through contact tracing. That is what took us to the factory for us to see what was there. You know, so we are meeting them. When we finish with the engagement, then things will come out. I think that is about so. The herbal group. We have got a report from plant medicine. We already have our medicines list committee. They are meeting them tomorrow to look at what things we can do. Yesterday, I did some investigations. There seems to be a little bit of a gap, and we are pushing to see what it is that we can also do with some of these medications. Their reports are testing bacteria, whatever. Then they go to FDA to test other things. But as to whether we even have the capacity to test for efficacy, that is what I've called them to meet together and let us see how we can try to do that one in our system. So by tomorrow, after the meeting, maybe we can come out with a better answer or report on this matter. We are forced ourselves to also use some of these things. Thank you very much.
I will start with guidelines for the various workplaces. Indeed, the general principles underlying the guidelines for the place to make sure that the employee work well-being will be ascertained. The various preventive measures that we have, how do we intensively implement this within the place of work by adhering to social distancing, the use of masks, making sure that the hand hygiene facilities, adherence to coughing and sneezing, other respiratory etiquettes. How do all places of work strictly adhere to this as we do and stay away, giving ourselves enough space and room for operation as we do it? If your place of work is congested and such that you will not be able to bring all your staff aboard, then you have to come up with a schedule which will permit some people to work effectively to undertake the essential services without unduly crowding together. People whose activity or the various employers whose work and employees whose work are such that they come in contact with other people. For instance, you mentioned the barbers, the saloon hairdressers. Clearly, if you are going to work on somebody, obviously you should have the mask on. The person that you also are going to work on should have the mask. And then should there be there should be minimal body contact as much as possible. You need to use the gloves, do use that. So how to effectively do your work without unduly placing others at risk. That is what is being prepared, and we've done these guidelines for quite a number of areas for operation business, and very soon they will come out. There was a question on the police cell chairman, whether we don't have that information yet. That the data that we have from Greater Accra, is it Tema? Yes, includes this, and as it has come out, you up and see if there can. Those people require special attention, and then you follow up, and if you observe anything that you have to take steps, you will do that.
A recently recovered person donates blood.
Indeed, the blood donation from a recently recovered person. If you remember the time of Ebola, you were talking about convalescent blood. Those that have recovered from the virus, the symptoms, and also have cleared the virus completely, they have antibodies that could be of use for people to use for treatment. So you can take the blood, store it. This is a special type of blood that you require. So as much as possible, when you recommend that they should do donation, they donate, you reserve the blood, label it as COVID-19 convalescent blood. We know will have the antibodies that has the potential to help people that are severely ill and then bring them out of the severity of the infection. So it's a special package, and you request that they donate, and you use them not for the general blood transfusion, but for special purposes. I think these are the questions that, and then voluntary testing. Considering the pressure that we have on our laboratories for now, it will be good that if everybody should know his or her status. The first question, if you are going for voluntary testing, are you going to pay for it? The state is going to pay for it. I don't have any answer. Two, if we should permit this, most workers and employers will say that I want all my staff to be tested. How is the country, the laboratory resource going to cope with this? This will bring undue pressure on the lab, and backlog that you have struggled to clear, very soon it will come back. So for now, let's use the guidelines out there, doing enhanced contact tracing. For any reason, if anybody is positive, all the contacts will be outlined there, listed, and be tested. Should there be the reason for somebody to fit the case definition for suspected COVID-19, that's the routine surveillance, then you would test these people. And all these costs, the government of Ghana has taken care paying for this. So voluntary testing is not part of the protocol. You cannot cope with it for now. If it becomes, as we are working, there are quite a number of things that have been put in place, including the rapid diagnostic test. If we have some of these rapid diagnostic tests evaluated with added sensitivity and specificity, and if people wish to know their status, either you are currently infected, to also help us to know whether your exposure was previous exposure, or the status that you have, whether you are having the infection, previously exposed, whatever the situation should be. Unless you brought all these things together as part of our testing capacity, it will be difficult to permit and make it as part of our policy with regards to voluntary testing. We don't encourage that for now. Thank you very much.
Thank you. Colleagues, we're going to wrap up shortly. May I just ask my colleagues to project the case count table as was projected, just to answer Sarah's question morning. So just one final note to observe. Different countries are adopting almost different strategies. And so sometimes even in comparing the numbers, you must be careful to compare apples with oranges. For example, when you see some of the numbers coming from Europe and the Americas, etc., reporting general surveillance numbers, i.e. people who have fallen sick and have come to the hospitals, because they are not doing enhanced
tracing and testing like we are doing. That is why, for example, if you take these numbers, 5,530, if we were doing what everybody else was doing, we will only be reporting 1,628, because that's a general surveillance number. That's those who really have, contacted the system to be tested. We have about 3,787 people in enhanced contact tracing. Those are people who have been exposed to the virus, and we have gone to search for them. We are deliberately spiking our curve. It's a very different strategy, because we want to find it early and deal with it. In so doing, you would find that the majority of that 3,787, literally all of them from what they tell us, are not sick. They don't have symptoms. They have been exposed to the virus. So if you are going to work a quick math out of that, 3,787 out of 5,530, back of the envelope, that's about 68%. So Ghana's number, 5,530, about 68% of them are people that we went out to search for in the enhanced contact tracing. It's a very different formula. If you didn't do that, they are not symptomatic. They will be in the community, they are fine, but they will also be spreading. So that by the time today you are reporting 1,628, which is what we would have been doing if we were doing general surveillance, you apparently have about 5,000 or an extra about 4,000 in the community that you don't know of, who are also spreading. By the time you find that 4,000, 16,000 are out there who are spreading. That is the wisdom in Ghana's changing strategy, to go for the enhanced contact and tracing, that will go out early, find these persons, and give them the kind of support. So if you're looking at today's data set, that's about 68% of what we have who are from enhanced contact tracing. I do understand very quickly, though the general translation will come very quickly. Our colleagues from the platforms want some information in chief very quickly. And then I buy the tabuna to Neoma Bibreso. Okwa yekono afanani and sabako, ye bode sayatutum, and no mampenia yama, ye tosumienu. Tabno de ato niema bebre so suku ye nkware masarachi nhyemu akese ina ye nko ansa na wasa so bo ho ban wo horo nsa wo use sanitizer na wo hye mask bi ye ma ya tititi entem tabno na ye de ato niema bebre so ene ye body spray atum no ye nim se de bi beba ye bebie na ye ntwen masada no mama ye mie ansa ya dwen de be ye ho nti o mampani afiase se ye nyambie ye mfiase nsin kunwa ne enwen se Eda paba yebe ya eden ye be ya boy ho ban na obi fa bi ansan obi nti one wonoma ehwe suku ho afiase esi nkonya kwan a yebetumi tibia bie schools wo abra teacher for ne nkwala yare ni bi wonoma eka ehyen transport operators wo mahia senior minister for health kan no one omo a ehwe enyuma hodo so employers so Asia said then abaye wo adwuma ma obi nkonko fa bi baabi wo ho initial reports ni bi e ba no nipa ba ko nyae no ebi mususu se epon ba ko a omu nyina fa ho di wura ebi abaye factory ni mu no ho do ordin sa fa ho we do ordin sa fa ho ebi su se no na ebi akwa fa ba ti kwan be na be fa so ma wono ma ehwe masoso etumi ede hyehyɛ aba ebe bo nipa ho ban ti sa nkonwe omampani afi ase ni mpanifosi asɔre ni masarachi for de omo de aba agudiefoɔ wɔn ma bɔbɔ de omo de aba ɔhwe ni nyinaa na mrepam no wakyerɛ kwan a sɛ da paba na yɛ bia ebetumi abɔ yɛ ho ban na obi so ankwa nkɔfa yare ni bi wa bra at the same time so yɛ bie na nipa so ahare no. Colleagues, we'll leave it here and we want to thank you for your time this morning. Hopefully on Tuesday we should have some good news to share with you when our team is back from Obuasi. Me pachomate sa foi na ye no omusi nkonwa ye ye mpesa wo be fa ne se ye ne usi nkonwa ye gye wadwen kyerɛ ye ne udi nkomo nti na kyerɛ se mbra na asesa no sa abre nti wutumi bia na wutumi fi ase ye bibi foforo dabi e komo na ye di e de atwen dapa ye no nsu atwen opɛ na se utirum koye o se ye ne di nkomo nti na kyerɛ se ne tabo na da so no ye pagya nti wutumi ye de a opɛ se o and the Afrina police for ne ade so ombebema be kyerɛ se mbra no ɛwɔ hɔ de tiɛsrɛ ɛyɛ nkɔmmɔdie sabre ɛda mo nyinaa ase. Colleagues, thank you very much. We'll see you on Tuesday.
All right, so you heard the Minister of Information there giving us a total rundown of the situation as it is so far. It looks as though a lot of testing has gone on, and as a result, we have our numbers and our cases going up. Of course, we know that within the society there is community spread. As a result of the community spread, there are people that we will not know that they are not. They are positive simply because they are asymptomatic. And so the contact tracing is important to fish out all those people. And I think it's a very important thing to understand that it's not like you're catching a victim or you're catching somebody who's a perpetrator of a problem. No. What you're doing is that you're actually preventing the person from becoming sick to the point where they need to be hospitalized. You see, and that's the positive side of this. Now, just to say, Jennifer, before you come in, I was looking at some figures and I realized that the global average for recoveries is at 37.5%. Wow. The African average for recoveries is at 34%. Right now, that's very interesting because it means that somehow, even though the death rates seem to be quite high in other places, it looks like recoveries are also considerably higher. Because when we look at Ghana's case, as of last week, our recovery rate was at 10%. It was at 10%. Okay, now the recovery has shot up to 12.5%. Nice. Which is good. So we are slowly climbing up. Hopefully, in a week or two, we should be getting closer to the African average, which is 34%.
And I'm relieved that the president has begun to engage stakeholders, right? Because a lot of us have been wondering what's going to happen to our wards. They're home. There are some parents who have been complaining about cost of internet alone. And we are still in a globalized world. So irrespective of COVID, there are countries where, people have access to free internet. So their children are studying like nothing ever happened. Can we compete? And what are the steps we need to start taking to ensure that we can get back to life as normal? So he's engaging people in the education sector. He's engaging manufacturers. He's engaging faith-based organizations. And as the minister said, it doesn't mean that we're going to lift all these restrictions anytime soon, but we're beginning to think about how do we work our way around COVID-19 so that by the end of 2020, we don't feel as though we didn't achieve anything because COVID-19 just came in and disrupted everything. But we'll be able to say we were still able to educate our kids. We were still able to keep our faith strong. We were still able to keep our manufacturing sector strong in spite of COVID-19. So I think that's a great thing that they're doing there.
Yeah. Also, just quickly before we go, the Minister of Health said something very important. Coronavirus has come to live with us, right? There's very few illnesses that have come into the world that we've actually been able to effectively eradicate forever. Very few. The majority of illnesses, we learn how to live with them. We adjust, we get vaccines, we find treatment protocols, we learn how to live with them. And he's saying that coronavirus is definitely one of those conditions. Of course, you all know malaria is still with us. You all know that even there are cases like polio we've eradicated in a lot of countries. There's a few countries that still have it. So this is what we have. I think we will win.
Yes, we will. Thank you guys so much for joining us for this extended version of Breakfast Daily. My name is Jeff. We'll see you 7:30 tomorrow. And from our editor, Evelyn, she says a big happy birthday to lawyer Isaac Overforce Mensah. I've been able to tell him. So she says she loves you very much and she hopes you enjoy your day. Bye, guys. We'll see you 7:30 tomorrow.
Take care.
times the people come, they want their results early, but you know that we cannot fast track the results because it takes some time. Average 48 hours, the test can be processed very fast. Of course, some can be low 24 hours, but on the whole, because the sorting procedure takes some time, so on average, results will come out.
For us, when we release a result and say it is positive or negative, we are confident in the results we have released because we know that we followed the various protocols. When we come to COVID-19 specifically, you have to first of all deal with when the specimen come in. There must be documentation that a specimen has entered into this lab. And so we've put in place a specimen receipt logbook. And so specimens that come in are logged into the specimen receipt logbook.
This is where we receive samples and then we sort them out. When some them into our specimen receipts book. Here what we want to know is where the samples are coming from, the category of samples that we are receiving, whether these are contact tracing, suspected cases, or treatment follow-ups. In that case, it will be a second or a third test. So we put that information into our logbooks, as you can see here. Once that is done, we now put our specimens here and try to match all the specimens to the case investigation forms. So there are times that you realize that the samples will come and then there will be no case investigation form. Or the one to do is to give the specimens laboratory IDs. So some specimens will come either with barcodes, names, or field numbers. So when we receive them, then we now give them laboratory IDs and then push them into the testing room for processing. As I'm speaking to you now, we've currently matched about 8,045 individual samples that have come through here. Now, the other thing we do is that you would notice that those who are handling the case investigation forms do not touch the samples. They are separate from those who are actually touching the samples. Now, this is a way of ensuring that infection is prevented, such that those who touch the samples do not touch the case investigation forms to contaminate them. Because at the end, there is somebody else who will be entering the case investigation form into our unique database.
our role here is the testing of COVID-19. So basically, we do the molecular testing in this area of the lab. So first of all, we do the extraction here. Then we draw our master mix, put it in the machine, and we get our results. So that's what we do here. So extraction, you want the RNA of the virus. So when you take the sample, you have a lot of things. You are picking a lot of other organisms, but you want the RNA of the virus. So you need to do extraction and get rid of the other things you don't need.
The extraction process is a very critical part of the whole PCR process. So right now, as we can see my colleague Loretta doing, she's at the final stage of extracting the RNA. Yeah. And then the method we are using here, we are using the magnetic bead extraction process here. So she's at the final stage of extracting the RNA, which we call the gold. So she's at the final end of mining the gold. That's why she's busy and it's not turning around. So after the samples come in and everything, we have the extraction kit. It goes through a process about aliquoting the samples, adding the reagents, incubating, heat incubation for some time, and then after that goes through the process of washing. And finally, we extract the RNA. Yeah, and from there we go to the PCR room for the addition and all that. If you don't take care and you introduce contaminants or there's contamination, you waste the whole process. You have to come back and do the extraction. So you waste time, there's money in terms of costs of reagents and all that. So it's a very crucial process here.
At the beginning, how the samples were coming in, so we had to take a lot of time. I mean, you have already been there. We had to take a lot of time to sort the samples. That was the only problem we had. Apart from that, work has been moving smoothly. Yes. Then here, the extraction method we are using, the equipment we are using for the extraction, we have just a few of them. If we could get more, then we could do the work very fast. So that's the only issue we have. Yes.
Okay, so once the extraction has been completed, you now need to prepare the reagents that you would use. Okay, so there's another room in which we prepare what we call the master mix, which also has the primers and probes, which targets specifically the RNA of your interest. in this case the coronavirus. Okay, so once you have that, you now have to bring reagent and sample together. So you add your reagents and then you add the sample as well within the same well. Okay, so when you have finished, then that plate is fixed into the machine. Okay, any of these machines which are available. Once it is fixed in there, you now have to go into the computer and set up your conditions for running the test. It's an experiment, so you need to set up the conditions for running the experiment and then assign each sample to each well so that the machine knows this well is for this sample, this well is for that sample. So you do all of that matching. And to facilitate that, we normally have a worksheet where we have located each sample on our plate. So we now have to tell the computer about this worksheet. So we assign the samples to each well on the computer. When that is done, you hit run, and the run time is approximately 2 hours for the whole cycling and amplification process, which is called the PCR. When that is done, you begin to see things like this. So this is an amplification. So it means there's some positive sample, something inside that particular well. So you then begin to see these curves popping up. When everything is done, you have to now sit down and analyze each well against the manufacturer's criteria. So it could either be positive, it could be a negative sample, it could also be equivocal, in which case you now need to repeat that sample according to the manufacturer's protocol so that you ascertain whether it is actually positive or a negative sample. Okay, so from the beginning, when we are aliquoting, we pool. And so in each pool, you have 10 samples. Okay, so when on the plate, you can fix about 90 samples thereabout on one plate. And if they are pools, then those are 90 times 10. Okay, so that's like 900 samples. That will go into one machine, and you have two machines. So if you have another 90 on the other machine, so it means you have like 180 pools. So 180 by 10, that's 1,800 samples. That will go through a 2-hour process to get the result. When it is positive, then we have to go back to that pool and unpool each individual sample, each of the 10 samples that were included in that pool, extract each of them, and then now rerun to determine which of the samples within the pool was actually positive or whether all of them were positive. So in determining our turnaround time, we are not just looking at the 2 hours in which the testing, the PCR machine runs, but we are also looking at the process from when the sample actually enters the lab and is registered as a sample within the lab. It goes through sorting, goes through aliquoting, we go through pooling, we go through extraction. Once we finish the extraction, we do the running of the test. If it requires repeating, you need to repeat it. If it's a positive pool, you need to unpool, extract, and then run again. And so in determining our turnaround time, we look at the whole process and what is included within the process. And so you could take between from 24 to 72 hours to release a result from when it enters the lab because of all of these processes that you need to go through. If it's a negative sample, it's pretty straightforward. It goes through, yeah.
When we receive the forms and then the lab numbers are given, the samples go to where it's supposed to be tested. And then from there, the forms also goes to where the data has to be entered. At the data entry session, we enter onto Excel sheets, which we took from Gucci because they will merge the data. So we use the same common platform for entry. And so when they enter, it's in a big database. We pick the database onto another laptop where we put in results when they are ready. So the one entering the data only gets to know what goes into it in terms of the lab numbers. The person doesn't know who is positive or who is negative. So that one is picked, and then we enter the results and match it with the numbers at another area. Initially, when we started testing, we were dealing with the case-based forms. They come in bulk. You have to do testing at the same time. You have to enter data. So it was a toll on the lab. Therefore, a system was put in place whereby the information on whoever we pick samples from are entered in the field. Once they are entered in the field, they put a number on it. So that is the barcode system that we are operating now. And therefore, once they put the barcode number on the sample, they put some on the form, which is like a line list. They have everybody's own there, and they put the same number on it. So they bring that to the lab. And then when it gets to the lab, we have a scanner and a laptop, which have the same system. So we scan the sample with a barcode, and then the information that was entered in the field comes up onto the software that we are using. And therefore, it takes that burden from the lab, entering individual details onto the system. Therefore, all that we have to do now is to enter results, and then the date the samples comes in. So that has taken a lot of burden from the lab. So currently, that is what is being done. We scan the samples, you get the information in on the system, and then you only have to finish testing and enter results. That is what is currently being done.
You know, the issue is that the test, it takes some time going through the sample collection and then sorting out the sample and processing. It takes some time. We also expect that we should get the right sample at the right time, sent at the right time for it to be done and done properly. So all this is what we need to let people understand. Because if you are asked to bring maybe sputum, for instance, and you bring saliva, of course, you don't expect to get good quality results. You see? Yes. And if you're also supposed to maybe take swab, oropharyngeal swab, for instance, try and cooperate so that we get the right sample to be tested. And it is not easy, but let's all try to cooperate so that we all work together. We have our routine work that we do, and this COVID has just come in, and the workload has increased, but the staff is the same. And because we need to clear a lot of samples at a time, we work day and night, so the pressure is on. And at times the people will come, they want their results early, but you know that we cannot fast track the results because it takes some time. Average 48 hours, the test can be processed very fast. Of course, some can be low 24 hours. It's not easy because we have some challenges, basically. Because you know that, as I did say, we are dealing with an infectious organism. So staff must be protected so they don't get themselves infected. So the issue of personal protective equipment, PPEs to put in simple terms, must be there every time. Because most of them are disposable. You wear them and then put them away. You can't wear them again. So at any time, you need to be changing. So we have a challenge of getting adequate PPE. So I believe if you get this thing to go a long way. And again, reagents are also something that we need to get it, because as the samples are coming, we need to test them, test of reagents. So we should get constant supply of reagents. Also some basic consumables too. We improve on our testing capacity. Staff be motivated, because if you are working, you have what it takes to work, you are motivated.
To this country, but across the globe, and we can see the effect of this infection all over. If we can reduce the number of people who are getting infected, then we can also reduce the likelihood that at-risk populations will get infected, and that would increase the death rate. If you have people with diabetes, respiratory conditions, hypertension, and all of those risky underlying conditions that have been outlined, we have people within the population who carry those conditions. And so if infection continues to increase because we are not putting in place the preventive measures, then such people, old elderly people and all, may get infected, and then that may lead to complications that would increase the number of deaths that we have, like you have in other places. And so we need to appeal to everybody to be mindful of the next person. The next person. Think about the next person. Whatever you are doing, your actions, your inactions, how it's going to affect that person who is next to you. And I think we should just be watchful for each other and ensure that we don't become the root of infection for other people.
I must say that though the barcode system is up, we wish we can get a lot of more laptops, because the samples that comes in are more, and then the scanning can be done concurrently, so that it's not only one person who is doing that, so to increase the pace at which we work.
Hi, I'm Fabienne Kay. You're watching the stream Home Edition, which is a show made under lockdown conditions, and we focus on lockdown life around the world. Today, we're talking about the coronavirus and pregnancy. I have the perfect place to start. Luma is a nurse practitioner, and she's expecting.
My biggest concern is the quality of the prenatal care that I'm able to receive in this pregnancy.